The new model from the University of Washington tonight, suggesting the worst, the peak in deaths, might happen within days, and a real indication tonight that because of the sacrifices Americans are making by staying home, that social distancing is saving lives. The ultimate death toll could be lower than officials first warned, but they urge caution, saying we cannot relax, that what we've done so far to slow this is working. So we begin tonight, as we get through it all, again with you, with Tom Yamas in New York.
Tonight, a rare glimpse at some of the toughest moments healthcare workers are facing every day in the war on the coronavirus. Dr. Daniel Nicola, an anesthesiologist, tasked with keeping critically ill patients from dying.
We are face to face with these patients who are breathing rapidly, coughing, producing sputum, and we need to place the breathing tube to properly oxygenate them and keep them alive.
And if that sounds difficult, there are even tougher moments. Maimonides Hospital in Brooklyn, bringing us into a makeshift ICU. That's Dr. Nicola on the phone, informing someone their loved one, who they likely haven't seen for days, is not doing well. Dr. Nicola ripping off his mask. He needs a moment, away from the chaos, away from the sadness.
One of the parts of our job is delivering bad news to patients. Honestly, it's one of the more psychologically exhausting parts of the job. So telling someone that their family member may not make it, it really does, it takes a lot.
A nurse telling us there's no doubt about the viciousness of this disease.
I was one of the people that, said this is fake, this is not true, this is going to be fine, we'll get over it, this is the flu, it's not the flu. This is so far from the flu.
Death from COVID-19 still so rampant. The death toll in New York State climbing again to a record level, 779 in just the last day.
The bad news isn't just bad, the bad news is actually terrible. Highest single day death toll yet. The number of deaths will continue to rise as those hospitalized for a longer period of time pass away.
But still, every day there are encouraging signs. Fewer new patients are heading to hospitals, and new hospitals are popping up, including this one inside the country's largest Gothic cathedral. This is St. John the Divine, and it looks completely different. First of all, you notice the rows of chairs are gone, and that white hospital tent underneath the Easter decorations. Remember, they were getting ready for Holy Week. The plan is to have 10 to 20 hospital tents stretching all through here, right up to the high altar. They hope to have hundreds of hospital beds to treat any patients that need the care. And in another corner of the church, we see this, the chapel. Hospital beds spread out everywhere.
The cathedral has always been a place for spiritual healing, and now it's being used as a place for physical healing.